Good evening, and welcome to today's Grassroots webinar for a safe climate. I am Kimberly Wills, Director of Strategic Partnerships for the Climate Action Campaign, a coalition of environmental justice, and health organizations representing over 15 million members across the country, fighting for strong federal action on climate. Thank you to our partners who are live streaming this across their platforms, and thank you all for joining. As we begin, I want to note to our audience that the chat function of the Zoom is disabled for the webinar, but you can submit questions that you have during the program via the Q&A function. And we do have time at the end of our program for speakers to respond to a few questions. We are also, during the program, sharing the link to our call to action so you can join us in taking action on this important topic. I do want to begin by sharing why it is so important that we are gathered here today. From deadly flash flooding to supersized hurricanes and wildfires to the extreme heat that is becoming more persistent in more places, the climate crisis is putting communities at risk. And now more than ever, we need the federal government to protect us. That's why we must fund and resource the agencies and the programs that respond to climate-fueled natural disasters, help communities to rebuild, and prevent the pollution causing these disasters. Now, right now, Congress is debating government funding levels. Federal science, research, and emergency preparedness agencies play a critical role in keeping Americans safe. And that's why Congress must reject and take active steps to prevent cuts or political interference. Now, we have an excellent lineup of speakers discussing why this moment is so important. And I am pleased to move us into our featured speaker part of the program to introduce our first speaker, Dr. Stephen Voles, Assistant Administrator for Satellite and Information Services of the National Oceanic and Atmospheric Administration, currently on administrative leave. Dr. Voles, I'll turn it over to you.
Great. Thank you, Kimberly, and thank you for inviting me here. We live on our planet, along with every other living thing, immersed in our environments, in our weather, and with our seasons. And normal weather dictates the patterns of our lives, and while extreme weather disrupts those patterns, and sometimes catastrophically. Over the years, we've developed ways to minimize these disruptions, and we all benefit now from generations of public investments in observing systems, in satellites and ships, planes and balloons, radars and buoys, and in information systems such that produce weather and climate models, hurricane models, fire and air and smoke and transport models, etc. Weather and other forecasts are not just something we use to inform our clothing choices for the day. They provide information that is essential to our quality of life, and at times provide life and death information. These systems and the people who build, operate, and use them to inform the decisions of our lives are national assets nurtured over generations. The systems are slow to develop, but are surprisingly easy to break. Our national weather and environmental information systems are at risk, and we are at risk because of specific actions taken and proposed to be taken by this administration. I'll provide one seemingly simple extreme weather event example showing what we have, what we may lose, and what that would mean, and that would be a wildfire event. Wildfires have been occurring with increasing frequency and severity over recent years, and we expect the rate and severity of those events to increase even more in the coming years. Fire indication often comes from federal observing systems. Satellite detection by NOAA's geostationary satellite is often the first indication of a fire in remote regions, and even in wildland and urban regions, those detections are shared with local observation to inform emergency managers. The fire response is both local and regional. Fire jumpers respond to control, or in some cases to monitor, the wildfires. And if the indication happens quickly enough, like from our satellites, the fire jumpers may get to a wildfire, but while it is small, and may be able to control and limit its growth. NOAA's Next Generation GEO program is developing improved satellite imagery that can respond within less than 2 minutes of the start of even smaller fires or smoldering fires, improving detection and suppression efforts. These improvements will be delayed and only partially implemented due to the cuts in the Next Generation program directed by the administration. When it comes to smoke from fires is both a regional and a continental problem, with air quality affected on a national scale. We monitor smoke from our satellites, including what's in the smoke and what the toxic chemicals may be there, using NASA and ESA and NOAA satellites. but many of the NASA satellites are up for cancellation. Our partner agreements with our international agencies for sharing data are under review by this administration, and the NOAA instrument in development to improve providing critical smoke content and air quality measurements, called the Atmospheric Composition Instrument, has been canceled. We understand how particulates get into the air and are transported through our airborne research conducted by the NOAA's Oceanic and Atmospheric Research Air Resources Lab, its Global Systems Lab, and its Chemical Sciences Laboratories. All of these labs are terminated in the President's FY26 budget proposal. Air quality measurements of emissions from fires and daily activities such as truck traffic and factories can be revolutionized with data from satellites. NOAA and NASA were working with the EPA to improve their PM 2.5 particulate monitoring reporting with real-time geostationary observations. However, the atmospheric composition has been canceled. The NOAA labs are targeted for cancellation. NASA is not going to do all of these earth sciences anymore. The research grants to explore these connections have been canceled or significantly delayed, and the EPA has recently been directed to stop collecting emissions data from major industries. I could tell similar stories about the proposed elimination of research and observations on significant rainfall events, sea ice mapping and tracking, ocean color observations of harmful algal blooms, and many other environmental events. The loss of personnel is already as impactful to our performance, but the President's FY26 budget proposal eliminates many more programs and systems. These changes being implemented now by the administration compound the damage of the personnel loss and are intended to lobotomize federal understanding of our environment. Thank you, Kimberly.
Thank you so much, Dr. Voles. Really appreciate your words. Next up, I would like to introduce Dr. Gupta. Dr. Vin Gupta is a public health physician and pulmonologist and a medical analyst for NBC News and MSNBC. Dr. Gupta, welcome. Thank you for being here. I'll turn it over to you.
Thanks so much, Kimberly. What an honor to be amongst so many like-minded individuals and leaders. So first of all, thank you everybody for all you do. This is never been more important. Just to give you a little bit additional context on what I do, I'm a pulmonologist. I sit on the board of the American Lung Association, and I'll have to. I'm taking this call actually from the Pacific Northwest in Seattle, and when I first landed in the Pacific Northwest about 15 years ago, you didn't have to worry about the summers and ever encountering, say, August smoke from a wildfire coming from British Columbia or from the Cascades. For those of you that have been in this part of the country, there's a lot of forest around us, but we haven't really had to deal with a combination of forest and heat and wildfires like we've had to over the last 8 years. And it's just fundamentally been a different reality that has surprised us. This used to be the haven for just amazing summers, Seattle summers, and it is no longer for a variety of reasons. But the primary one is we have these insufferable wildfire smoking events that really just completely, I hate to say it, they pretty much negate August as being a month where you want to be here. Which brings me to my comments at this event. The linkage between climate and health is inextricable. And, I was part of an effort towards the end of 2024 to protect the Climate Commitment Act, which some of you may know was Governor Jay Inslee's signature climate law here in Washington State, one of the most forward-thinking climate laws in the country at the state level. We talked about transitioning gasoline school buses to or off diesel to electric, because we know that diesel smoke exposure to young kids precipitates asthma and is a huge risk factor for asthma risk. He did anything and everything to control and mitigate the risk of wildfire smoke through forest management and other measures. Did a lot towards protecting what indoor air quality looks like in public settings. Really critical. We know this from the pandemic, that indoor air quality is not only important to guard against the spread of an infectious disease like COVID-19, but it actually does a lot to safeguard the lungs of, say, children learning in a school environment if there's terrible air outside from a wildfire. We know indoor air quality is linked to cognitive function and testing scores. So these HVAC improvements to schools were really important. What we realized when we talked to the public, because I know all of you are advocates and leaders in the climate space and really want to reach as many people as possible that don't necessarily always or don't necessarily already agree with our points of view. What we realized is talking about climate and the way the environment is changing around us through the lens of human health is incredibly persuasive. We actually flipped some of the surveys and polling around how people thought about the Climate Commitment Act because we really focused on the health benefits of that act and the ways in which it was going to protect anybody, whether they were grandma, grandpa, all the way down to a young infant. How they really, these forward-thinking policies were not about, industry and the impacts on industry. And because that was often the way it was framed by opponents. Oh, this is going to be an additional tax on your gas or whatever it was. No, we were really talking about lifespan, health span, living a long, healthy life. And that resonates with people. Just a few specifics here. Heat. We talk so much and we all feel it on our skin. Heat is increasing. We all know it. Summers are longer. What are we actually seeing in the data? Turns out, by the middle of this century, we're going to see in the Southwest United States a doubling, we expect, unfortunately, a doubling in heat-related deaths just due to rising temperatures in the Southwest United States. And that's going to be a huge burden for health systems, for hospitals across the country, especially those that are older with pre-existing conditions. That's going to be really tough to navigate. So heat is only going to get worse, not better, and in more parts of the world, especially here in the United States. And it's something we have to be prepared for. And frankly, your health system, wherever you are in the country right now, is already thinking about this. I'll say our ERs here in the Pacific Northwest are prepare in June to make sure we have enough IV bags, to make sure we have medications to rapidly lower people's temperatures. I mean, we are quite literally thinking about inventory, thinking about personnel, thinking about what EMS needs to be thinking about on the front lines when they're triaging somebody that might have fainted on the street. This is changing how we think about providing patient care, emergency patient care between the months of May all the way, frankly, to the end of September. So the heat and human health, air pollution, sixth leading risk factor now for death and disability worldwide, independent risk factor for death and disability worldwide. That is stunning. Air pollution. You can't necessarily see it with your own eyes. You can if it's really bad, if there's terrible smog. But we all know what it feels like when you breathe it in. New York City just had a pretty terrible smoke-filled summer not too long ago. And I think when the media capital of the world experiences something like that, we all start to pay attention. But what I want to make sure everybody is keeping in mind, if you have a young child with asthma, if you have somebody older with congestive heart failure, or frankly, if you're otherwise healthy, this impacts all of us, and it's impacting all of us more and more frequently in more and more places across the country, in places like New York City that don't necessarily have forests surrounding them, but they're still impacted by states to the north, by Canada and the wildfires up there. It is quite literally impacting all of our health. It's impacting longevity, our immune system, healthy aging, in addition to obviously our lungs and our heart. So something to keep in mind. And then lastly, I'll just say drought and water quality. We're seeing more places across the world, frankly, not have enough water, potable water, because droughts are now becoming a way of life. In addition to, say, pandemics, we're seeing that there's a link clearly between increasing temperature disturbances, environmental disturbances, and the risk of a pandemic. So, climate and health. I know people sometimes get triggered when they hear the word climate or the phrase climate change, but if we focus on health, something that I think all of us can agree with, regardless of our partisan affiliation. It's powerful, it's persuasive, and it changes minds. And I've seen it with my own eyes. Kimberly, I'll kick it back to you.
Thank you so very much for all your words. Next up to speak will be Dr. Brenda Eckwarzel, the Senior Director of Scientific Excellence at the Union of Concerned Scientists. Thank you so much. Take it away.
Thank you so much for having me with you today. And thank you, Dr. Volz and Dr. Gupta, for powerfully addressing the threats to NOAA, NASA, and the links between climate and health, as well as what we can do there. I'm going to focus on the Federal Emergency Management Agency. The president's budget request just does not reflect the essential work done by dedicated professionals at NOAA, FEMA, and other agencies. In the current administration's efforts to slash climate change science and undo climate progress, the administration is willing to put the lives and livelihoods of thousands to millions of people at risk. And Congress can fix this. You can help make sure they do. So when the federal budget cuts bulldoze vital parts of our national climate and weather science like NOAA and our response system like FEMA, people suffer. We live in a changed and changing climate. We experience more frequent and more extreme weather-related disasters, and we rely on FEMA to coordinate federal disaster response. We also rely on FEMA to support local, state, tribal, and territorial governments, not just to recover from the last disaster, but to prepare in advance for the next one. The current administration has gutted FEMA's staff by 1/3. They've slashed programs that build disaster preparedness. They've shifted the burden of disaster response to local and state governments. So basically, FEMA, in its critically weakened state, we can't expect FEMA to respond to large or multiple disasters in the ways we need and expect. So here at Union of Concerned Scientists, we tend to call the months between May to October danger season in the Northern Hemisphere, and especially for the United States. So in danger season 2025, we've already seen record heat, disastrous floods, and intense wildfire outbreaks. All these impacts are linked to climate change. And now more than ever, we need our science agencies like NOAA, NASA to tell us what climate to prepare for. And we need FEMA to help us recover, prepare, and come back stronger. So with the end of the fiscal year on September 30th, it appears some form of a continuing resolution or CR will be required to keep federal agencies open. Any continuing resolution must provide FEMA, NOAA, and other vital agencies with adequate funding to reverse the damage that has been done and allow them to accomplish their missions. After whatever stopgap measures are required, Congress needs to pass robust, full-year funding for all these agencies. On FEMA, Congress needs to do three things immediately. Hold this administration accountable for undermining FEMA's ability to fulfill its mission, especially the Department of Homeland Security Secretary. Fully fund FEMA immediately and replace the staff who have left or have been fired. Urgently provide supplemental funding for the Disaster Relief Fund. It's really hard to imagine a more important responsibility than for our elected representatives to protect the lives, homes, and businesses of their constituents. The administration must, sorry for that, is shirking that responsibility, and Congress must push back. You can help by acting with us now. Thank you all for listening and for paying attention to these critical issues. I will now hand this back to others to take it from here. Thank you, Kimberly.
Thank you so very much. I appreciate your words. Next, we'll hear from Seema Wadhwa, founder and CEO of Health in Climate and Net Positive Solutions. Seema, the floor is yours.
Thank you so much. Thank you so much for having me. And I'm so honored to be with such esteemed colleagues. And also thank you for all of you who are out there advocating and trying to fight for all of us to have a safe and just environment in which we can all be healthy and active. So I've spent over about the last 20 years working with health systems in preparing for their own sustainability and resilience. And, what I've seen over that period of time is just the increase in the impacts we're seeing from how climate is impacting health, but also the resilience of health systems. So, Dr. Gupta, you did a great job highlighting how your health system is getting prepared. And, while that work is happening and very important, there is also the reality that in some ways it is, we are just not going to be well equipped to address the drastic impacts we're seeing from climate change. I'll highlight two key stories. One of them coming out of Kaiser Permanente and the 2018 Tubbs fires, where the only thing between the hospital and a fire was, a small channel. And what that meant was, in the heat of the moment, literally in the heat of the moment, the hospital needed to be evacuated. And while it was a successful evacuation, it truly was the scenes you see in movies with flames behind you and patients being carried out on stretchers. And unfortunately, that was not the only time that hospital was evacuated because of wildfires. Additionally, and more recently, we have the situations that stemmed from Hurricanes Helene and Milton, in which critical supplies that power health systems across the nation were severely impacted. A IV fluid management plant in North Carolina was impacted by both Hurricane Helene and Milton, to the point where 50% of the production of IV fluids in the country was truly impacted. And what that meant was hospitals were not able to perform elect surgeries. What that meant was the conditions of care were altered because of the disruption we're seeing in our environment. And my esteemed colleagues have done such a vivid job of highlighting what this means to health. But in addition to the impact it's having on the operations of hospitals and health systems, our anchor institutions that need to be there when all else is failing, it is also wreaking financial havoc, not only on health systems, but on all organizations. When we look at some of these billion-dollar events, many of you may have heard of the classification of billion-dollar events we've seen from extreme weather. Those events actually do not completely account for the health-related costs stemming from climate change. That mean? That means the increased cost from ER visits, from hospital admissions, from those patients that were referred to earlier. Those costs are not being accounted for. And I also wanted to highlight that those costs are not only costs that the health systems or health insurers are seeing, but over about 80%, actually 79% of employees from large employers are covered by self-insured plans, meaning the companies are taking the brunt of those costs, and they are then being passed on as one of the highest expenses. So, we've learned great reasons as to why we need to protect our institutions such as FEMA and NOAA and others from the perspective of health, but also, thinking of the resilience of our anchor communities and thinking about the financial impacts we're seeing, where extreme weather events alone are causing billions of dollars of impact from heat and health implications. There really needs to be a greater urgency to act and to protect. And for that, I am really grateful that you are all here and hope that we can all lean in to urge action at a greater level. So thank you so much.
Thank you so much, Seema. Next, I'd like to introduce Michelle Roos, Executive Director of the Environmental Protection Network. Michelle, thanks for being here.
Thanks so much, Kimberly. Hello, my name is Michelle Roos. I'm the Executive Director of the Environmental Protection Network. We are a 501c3 nonprofit organization with a small virtual staff and a nonpartisan volunteer network of over 700 former EPA staff like me. We're health and legal and scientific experts, and we are deeply concerned about what's happening to the Environmental Protection Agency, and more importantly, as has been referenced many times, to our health. Whatever your politics, we all drink water. We all breathe air. We're in this together. So what happens at the Environmental Protection Agency happens to all of us, to each and every one of us and the people we love. It's why we need to raise our voices, because health is more important than politics. Unfortunately, not everyone believes that. EPA Administrator Lee Zeldin has taken a chainsaw to EPA and therefore to all of us. He is favoring corporate polluters over our health. He has announced that he'd be rolling back 31 regulations, and that's going to put 200,000 lives at risk. He's terminated billions of grants meant for low-income communities to improve their infrastructure. Remove lead pipes, install solar panels, clean up air, clean up water. And he's driven away thousands and thousands of staff. Key programs, climate, environmental justice, science offices have been completely dismantled at EPA, and even more have been gutted. This is nothing less than a systemic dismantling of EPA's ability to protect our health. And it gets worse. We're talking about the budget. The Trump administration's fiscal year 26 budget proposes a staggering 55% cut to EPA's top line funding, which would give EPA its smallest budget adjusted for inflation since the Ford administration. And we will all suffer the consequences with more asthma risk, more cancer, more premature death. These cuts come at a time when extreme weather, floods, wildfires, hurricanes, record heat are devastating all of our communities. These aren't abstract, theoretical, future problems. These are climate impacts with real health consequences right now. And at the center of all of this is a Trump administration putting politics over science, putting money over our health and safety. And it hasn't always been this way. The very first EPA administrator, William Ruckelshaus, a Nixon and later Reagan appointee, said that EPA must follow the science, follow the law, and be transparent. He knew, EPA career staff knows, that without science and the truth, EPA can't do its job. And without a robust budget, EPA can't protect us. So here's where you come in. Elected officials need to hear from you, from all of us. Our voices can make a difference between whether or not the protections set up by the Environmental Protection Agency stand or fall. So we all encourage you to contact your representatives, tell them what EPA means to you, why this is important to you, your kids, your neighbors. Urge them to reject these devastating cuts and require EPA to work for us again. Thank you.
Thank you so much, Michelle. Now, our final speaker is Frank Sesno, Emmy award-winning journalist and founder of Planet Forward. Frank, the floor is yours. Appreciate you being here.
Thank you very much, and thanks to you, Kimberly, and everybody for organizing this, and to the other distinguished speakers. I'm honored to be sharing a few minutes and be in your presence and everybody else who's here. I do want to talk about some of what we've just heard in sort of a big picture way. A few years ago, I had someone who was in then President Barack Obama's Office of Science and Technology Policy come to my class. And I swear I did not write this for her, but what she said was, when it comes to climate change and many of these issues, we do not have a science problem, we have a communication problem. And today we have seen at a very polarized nation, and as we've heard this evening through all these examples, a deeply, deeply challenging situation from this polarized country, from our polarized politics, and our politics that actually do not reflect the will and the opinion of the country at large. I'm sure many of you are familiar with the Yale Center on Climate Communication and the 6 Americas that they have tracked through polling. It's worth a moment, and it's worth a moment of reflection. The alarmed, the concerned, and the cautious together, and I'm giving the cautious some benefit of the doubt in that they understand that climate change is real, but they're cautious as to how far they go or whether they ascribe human intent, but they basically are on board with this, represents 72% of the American public in 2024. From 2011 to 2024, the percentage of alarmed grew by 11%. The concerned shrunk by 4%. That went into the alarm. The cautious shrunk by 5%. That went into the alarm. People have seen, as Dr. Voles talked about before, and they've experienced wildfire, smoke, extreme heat, extreme weather, floods, hurricanes. They understand that something is going on. So the question for you and for us is how, in an environment such as this that we're in now, and whether you're lobbying a Democrat, a Republican, an alarmed or a concerned, how do we speak to them? Fundamentally, we must tell stories. And what does that mean? If you're going to talk about fire jumpers, have a name. How old was he or she? Where did they come from? Where did they go? What happened when they got there? You're going to talk about particulates. Which particulates? For which community? Does the child have a name? Did the child have a disease? Was it a single mom or a married couple? Did they take the kid to a doctor? Did the kid get better? We need to bring people into the human experience because otherwise this just sounds like policy and numbers and science and data. And with all due respect to everybody here, what is going to move people, what typically does move people is stories and people and particulars, examples. That's how we bring it to life. Last point, and then I'll stop. A few years ago, we had a farmer come and speak to us, fourth generation Maryland farmer. He never talked about climate change, but he talked about how over the generations of those in his family owning this farm, the rains had changed to the point that he needed to reberm and redrain his property or all the topsoil was going to run off. All he wanted was to keep his farm going and pass it on to his children. It was a powerful story. He actually was an advocate for action in climate change. But that's how he spoke to his neighbors who were also farmers. So I will merely conclude by saying that there are stories we need to tell. They do not end with they lived happily ever after. They are stories of real struggle and concern. And in this environment, as this person said some years ago, I believe actually we do have a science problem, but we especially have a communication problem. So with that, I wish everybody great good luck.
Thank you so much, Frank. Appreciate you. Now we're also joined by Quentin Scott of the Chesapeake Climate Action Network, who will tell us more about how we can take action in this moment. Quentin, thanks for being here.
Yes, thank you, Kimberly. I really made it a point of emphasis to make sure I joined the call tonight because we are truly at a pivotal moment in our nation's history and a pivotal moment in our personal lives. Our freedoms are facing a coordinated assault by the Trump administration. I can't help but remember to last year when Trump promised the fossil fuel oligarchs that if they raised him $1 billion, he would allow them to do whatever they like. They raised about half of that. And what do you know? Every agency dedicated to protecting communities from devastating impacts of climate change has fired staff, withheld funding, reorganized priorities, and invited the Supreme Court to strip the agencies of their own authorities. How does any of that sound like in the best interest of the people? Let's be clear. This administration isn't waiting to implement its most dangerous and expensive anti-environment, anti-science agenda in history. We've already seen the consequences of undercutting climate protections with deadly results, from dozens of children being swept away in flash floods in Texas to hundreds dying in wildfires. We don't have until November 2026 to fight back. We have to do everything in our power now to push back. We have a right to a safe climate, clean air, and clean water. We must demand our government act to protect communities through life-saving work of the Environmental Protection Agency, the Department of Energy, National Oceanic and Atmospheric Administration, and the Federal Emergency Management Agency. Together, these agencies, when funded and staffed appropriately, can ensure that we follow the science, protect our families from extreme weathers triggered by climate crisis, and reduce the pollution that causes climate change as quickly as possible to stave off even more damage and destruction and lives lost in the future. They must be allowed to do their work free of political interference. We are truly at a pivotal moment, and it feels uncertain. But here's what gives me hope. Yesterday, CCAN, Climate Action Campaign, and other advocacy organizations delivered 250,000 comments to the EPA, rejecting their attempt to repeal the endangerment finding. Hundreds of events have been organized across the country celebrating solar energy for Sunday this weekend. People are standing up. Right now, Congress is debating and deciding what priorities will be funded. On this call, we believe we should prioritize protecting Americans from dangerous pollution by ensuring we have scientists and public health experts doing work at DOE and EPA, keeping us safe from deadly extreme weather disasters by safeguarding research at NOAA, NASA, and the National Weather Service, and by funding preparation and recovery efforts at FEMA. As Congress considers FY26 appropriation, Congress must reject cuts to these agencies, must ensure these agencies are funded at the levels required to protect Americans and the climate, and must demand that the administration follows the law by spending congressionally appropriate fundings as intended. So it's time to stand up again. Call your senators, call your House of Representatives members, and let them know that they must fully fund our agencies, implement guardrails that require the administration to spend funds as Congress intended. Right now on your screen, you'll see a QR code and a link. If you follow those, you will be able to make calls to Congress. As a former staffer, constituent calls make a huge difference. The more calls offices receive, the harder it is to ignore. So call tonight, call tomorrow, and have everyone you know call, call, call. Let's keep this up until we protect our right to a safe climate. Thank you, and I appreciate being here tonight.
Thank you so much, Quentin. I hope everyone's listening and will join us in making calls to Congress. We do have time for a few questions with our speakers. Folks can use the Q&A function to submit a question. I have a question that I would like to direct to Dr. Gupta. The Trump administration is attacking public health and science on all fronts. How do we maintain public trust in scientific expertise in the face of these attacks?
Gosh, it's such a pertinent question, especially today, when it comes to how we're revisiting the childhood vaccine schedule. It's really, I loved Frank. I mean, I loved everybody's comments. I thought Frank's point on storytelling is crucial because, you know, unfortunately, a lot of us have lost. I mean, not anybody on this call, but a lot of us don't know what it's like to have acid rain, a reality, or maybe are not impacted by some of these climate catastrophes as much as some of us are. Or in the case of infectious diseases, polio, measles, mumps, rubella, varicella, just revisited by the current CDC. They just revised it 2 hours ago, the indications. A lot of these infectious diseases we have not had to reckon with. And so what I found to be most effective in the wake of the measles outbreak, which I think the analogies from that are relevant to this conversation and linking climate health, is exactly what Frank said. Understanding, making sure we have a common understanding of what the threat can do to our loved ones. In the case of climate, we talked about it. In the case of, for example, measles, most parents in West Texas, because I have close colleagues down there, when they were informed that measles does more than cause a rash, especially those that chose not to vaccinate their children, they were surprised that severe pneumonia and supplemental oxygen was necessary, and an ICU bed in a pediatric hospital was likely required to save their child's life. And so I think making no assumptions, telling stories, as Frank said, very persuasive. And I hate to say it, but I do think fear motivates. And in the sense, in the setting of a situation in West Texas with measles, for example, it has caused people to really actually adopt vaccination. And it's unfortunate it took that, but it's motivating. So I do think we have to be opportunistic in some ways and leverage both storytelling and the moment to reach people. But I don't know if we have another choice.
Thank you for those thoughts. We'll have time for one more question. I'm going to give this question to Dr. Voles. The question is, with funding cuts limiting preparedness resources from the federal level, what will this mean for local leaders who are preparing for or responding to extreme weather events?
So thank you. That's a great question, and I think was identified by Brenda or by Michelle about the hits to Brenda to hits to FEMA. The capacity at the local level is not there to pick up what had been covered by FEMA at the national level. What is possible for the local environment, the local communities, is to keep track of the information that is made available in advance. What this current state changes have made is that we have not terminated the information provision, but we've shut off the communication side. Back to the comment about communication. So finding that data would not be easy. But at most states, it was really to energize your state and local level, your state climatologist, your state emergency management teams, to talk to them about what they can do to identify the losses in information content or the gaps in information, and then see how we can reestablish those. The data are still available, but the communications paths have been severed in some places or paused. That doesn't mean that you can't still get it, but it takes more effort on the local level to reach back to those sources from NOAA or from FEMA for where the information might be available to prepare for the upcoming disasters. So it really is working at best you can with your state level to reconnect those gaps, those connections to the federal systems at NOAA and at FEMA that are there but are not communicating per the guidance that we're receiving right now. Thank you.
Thank you so much. We've received a question in the chat that has been answered, but I want to emphasize it for all our audience members. The question is, what actions can I take in a deeply red state to encourage environmental awareness? Calling and rating my legislators has zero effect on them. They vote along party lines. We want to urge folks in all corners of the country to call on Democratic leaders to fight for a safe climate. If you are following along in the chat, the link to the resources to make a call is right there for you, and there is a script available for when you make those calls. So I hope that you will join us. This is all the time that we have for tonight. So I want to say to our speakers, thank you so much for your expertise and for your words today and your time. To our audience, thank you so much for all that you do to stand up for the climate. That concludes our program for this evening. Thank you so much and good night.